Under normal circumstances, Rebecca Geach would qualify for the COVID-19 vaccine. She has epilepsy, and on the Joint Committee for Vaccinations and Immunisations, the JCVI priority list, she would be number 6. But she is pregnant, and that bumped her off the list.
To me, that didn't make any sense because it was a contradiction. I need the vaccine because I have a clinical vulnerability. If I'm pregnant, I'm more vulnerable on top of that. So surely I should definitely at least be offered the vaccine.
Rebecca sought advice from the Royal College of Obstetricians and Gynecologists, from the Epilepsy Society and from her own neurologist, and eventually fought her way back onto the vaccination list. But her experience highlights the lack of information and clear advice about COVID-19 and pregnancy, not least that the vaccines were not trials on pregnant women. Why does this matter? Because in a small number of cases, COVID-19 does appear to be harming pregnant women and their babies. Now, the emphasis is on a small number. The vast majority of women are fine, even when they become infected. But there is data to show that some are ending up on intensive care, and sadly, lives have been lost. In England, Wales and Northern Ireland, the data shows that 1 in 9 female intensive care patients under the age of 50 was either pregnant or their pregnancy ended in the previous 6 weeks, mostly through delivery of their baby. More than twice as many pregnant women were admitted in January compared with April, while it was 3 times as many of those who were recently pregnant. 5 women admitted since September have tragically passed away, but the vast majority have been discharged. This increase in numbers could be a reflection of more people in general, and particularly younger people, being infected and ending up in hospital. But this is being studied now because it's not clear. At Milton Keynes Hospital last month, we met Revathi Pentapati, who had been admitted to intensive care with COVID and had an emergency caesarean, delivering twins. We were there the moment she finally met them a week later. Leah Atherton was also admitted in January with COVID to the John Radcliffe in Oxford. She too had an emergency caesarean after her placenta abrupted.
After she was born, she was taken away to special care for some help with her breathing. She was put on life support, and then unfortunately I had to go back up to the COVID ward to recover. So I didn't actually get to see her or touch her or anything until she was day 5.
And this mother, Steph, who did not feel up to appearing on camera, sent us this.
I was unwell for 4 days, but could manage at home with fluids and rest. I'd felt better for around 3 days when I noticed reduced movements. I attended the hospital in the morning, and Evelyn appeared well at first. By the evening time, she'd sadly passed away. I was 37 weeks pregnant. The post-mortem results showed that COVID had attacked my placenta. Evelyn was negative for COVID. I was fine, but my baby was not.
The pattern suggests that most women, or the majority of women who have more severe COVID in pregnancy, are in the 3rd trimester, in the latter half of pregnancy. It's still really, really important for pregnant women to be absolutely stringent about the hand washing, the mask wearing, the social distancing, to try and minimise their risks of COVID-19. And it's really important that when we're thinking about which groups we should prioritise for vaccination, that we remember that the vaccine can benefit both mum and baby in that circumstance.
In a statement, the Department of Health and Social Care said, however, that vaccines should only be considered when the potential benefits outweigh any potential risks for the mother and baby, and that they continue to follow the advice of the JCVI. But Rebecca Geach disagrees.
By excluding people on the basis of some vulnerabilities means that some women who are pregnant and may be working on other front lines, such as teachers, will miss out on the chance to have a vaccine.
Well, earlier I spoke to Dr. Jo Mountfield from the Royal College of Obstetricians and Gynecologists. I started by asking how concerned she was about pregnant women's susceptibility to COVID.
So, of course, we're concerned. As you know, right at the beginning of the pandemic, the government designated pregnant women as being in a clinically vulnerable category. That said, the evidence is still reassuring for pregnant women that they are no more likely to catch COVID than somebody who's fit and healthy of a similar age. So I want to be reassuring about that.
There are more pregnant women in intensive care, it seems, in this current wave. How much of a cause for concern is that?
Of course, it's a concern because we don't want to see any pregnant women in intensive care. We don't know exactly the reasons why that may be. It may be that actually in this current wave, more younger people have actually been infected with the COVID virus, and therefore overall more pregnant women are getting are being infected and becoming more unwell. And we absolutely know that in the later stages of pregnancy, after 28 weeks, there is an increased susceptibility to having more severe disease necessitating admission to hospital. And the consequences for the baby are, in order to help the mother, often the baby needs to be delivered prematurely so that it helps the mother recover. So there are implications for both baby and for mother. And yes, it is a cause of concern, but it isn't. We don't have the evidence yet still to say precisely why there does seem to be an increase in numbers in this wave compared to previous waves.
Given the lack of evidence, though, wouldn't it be wise for the Joint Committee on Vaccinations and Immunisations to consider broadening the number of people who would qualify for a jab, pregnant women with broader underlying conditions?
I think what we need to do is make sure that we're getting the evidence around this. So what I would say is we absolutely need to make sure that we are accurately recording all the data of the women who are having vaccinations at present, what the impact on them is immediately in terms of any potential side effects, but also the longer term outcomes, so that we can quickly collect the data, which means that we can then be more reassuring about the fact that the vaccination should be offered to all women. Because unfortunately, pregnant women were not included in the original trials, and so that's why we haven't got the safety data for those women.
How big an oversight was it that pregnant women were not included in the original trials, and how urgent is it for that to be rectified, do you think?
Well, I think it's absolutely urgent that we rectify it. So yes, and those trials are starting. Why weren't they included right from the word go? Well, there is a process around undertaking these sorts of trials that starts in younger, fitter people and then expands outwards. And pregnancy is one of those difficult situations where you've got both mother and baby in terms of the potential effects.
Why do you think it is that women's health has been overlooked during the pandemic?
I think generally women's health is not so much as a priority. If you look across the board in terms of the amount of research that is funded around what happens to women in terms of the outcomes, we're as women, we're just not as highly prioritised as some different areas. And I think that's just why. I think that's societal rather than anything else, quite honestly. If you want my opinion, I think that's just the way society is around women are not as highly prioritised as men in a whole range of different arenas. And I think medicine is just another of those.
Dr. Jo Mountfield, thanks very much.